If you go to the emergency department with abdominal pain and they do this big old workup on you, the doctor orders CAT scans and x-rays and blood work and everything's negative, what could be causing your abdominal pain? Hi, I'm Dr. J Mack. I'm a board certified emergency doctor and I've been doing this for 10 years. And I run into this situation fairly frequently. And at that point, I sit the patient down and we talk about what it could be. First of all, you are not crazy. There is something causing your abdominal pain. It may not be an emergency, but it can absolutely cause a significant amount of distress and discomfort. If you're a female and you have pain in the lower part of your abdomen, and this is recurrent pain with a negative workup in the emergency department, I would say one of the most underdiagnosed diagnoses for females is endometriosis. That's when the inner lining of your uterus can come out of your uterus, out of the fallopian tubes, and insert onto the uterus, the fallopian tubes, really any structure in the abdomen, and cause this recurrent abdominal pain. This is a really tough one to diagnose because you can't really diagnose it in the ER. You have to see an OBGYN, and to 100% diagnose it, you have to do a laparoscopy, which is when you cut in through the abdominal wall and physically look in there with a camera, which nobody wants to do, hence why people are not diagnosed. If you're having upper abdominal pain with a negative workup, there are lots of things that can cause that, things like gastritis or inflammation of the lining of your stomach, an ulcer that could be in your stomach or your small intestines. You can even have gallbladder pathology that does not show up on a CT or an ultrasound. You may even need a test called a HIDA scan, HIDA scan. This is a nuclear medicine scan that can actually pick up some instances of infection of the gallbladder that are not picked up by ultrasound or CAT scan or labs, or functional issues with the gallbladder like decreased ability to empty. One diagnosis that's really not well understood but can absolutely cause severe symptoms is an abdominal migraine. This will have a negative workup but can cause severe recurrent abdominal pain that will last anywhere from 1 to 72 hours. We don't really understand what causes it, but it's thought to involve the gut-brain axis. Gastroparesis is another one that'll cause severe abdominal pain, nausea, vomiting. It's basically slowed emptying of your stomach or movement of your intestines, and that can be caused by diabetes and is associated with GLP-1 use. IBS, or irritable bowel syndrome, can absolutely cause severe recurrent abdominal pain. These are usually severe generalized abdominal pains that are relieved by defecation. Additionally, you could have a mass in your intestines that does not show up on your CT or ultrasound, so it's very important that you follow up with GI. And finally, scar tissue. And if you've had surgeries before, you could have scar tissue in your abdomen that causes kinking of your intestines or slowed movement of the intestines that can cause fairly severe pain and will not show up on the CAT scan. Hopefully this information was helpful to you. If it was, drop me a follow and a like, and I'll make some more stuff like this.